How you doing, everybody? My name is Dr. Sami Baya. Please welcome back to my YouTube channel. Dr. Ramani on Narcissists. That's the title of this video. Dr. Ramani is a well-known psychologist and expert on narcissism. She shares valuable insights on the topic through her YouTube channel, through her books, and through interviews. Dr. Ramani specializes in helping people understand the behavior and dynamics of narcissistic individuals, particularly in relationships. Dr. Ramani explains that narcissism exists on a spectrum, and while not every narcissist will be overtly abusive, many narcissists exhibit manipulative or toxic behaviors that can deeply affect others. So, in this video, I'm going to talk about the key points Dr. Ramani often touches upon regarding narcissists. Dr. Ramani talks about grandiosity and self-entitlement. Narcissists tend to have an inflated sense of their own importance, and they often expect special treatment. They may belittle others to elevate their own status, and they believe they are deserving of admiration and respect without earning it. The other key point about narcissists is they lack empathy. Narcissists struggle to empathize with others. They are often unable or unwilling to understand or care about the feelings, needs, or perspectives of others, which can lead to emotionally harmful behaviors. Many narcissists use manipulation techniques like gaslighting to control or confuse others. Gaslighting is a form of psychological abuse in which the narcissist makes the victim question their reality, memories, or perception of events. In relationships, narcissists may idealize someone at first, but once they no longer see the person as useful or as an object of admiration, they often devalue and discard them. This can be emotionally devastating for the person who has been devalued. Now, the other key point about narcissists is narcissists thrive on constant validation, constant praise, and attention. And this is referred to as their narcissistic supply. Narcissists seek to be admired, often at the expense of others' emotional well-being. Dr. Ramani also discusses the importance of setting boundaries, practicing self-care, and understanding that healing from a relationship with a narcissist can take time. Dr. Ramani stresses the importance of therapy for those who have been affected by narcissistic abuse. Narcissism is a spectrum, according to Dr. Ramani. Narcissism is not a binary trait, it's a spectrum. Dr. Ramani explains that narcissistic traits can range from mild to extreme, and that not everyone who exhibits narcissistic behaviors is a full-blown narcissist. So understanding the range helps to assess behaviors more accurately. Narcissistic personality disorder is a clinical diagnosis characterized by grandiosity, a need for admiration, and a lack of empathy. And narcissists often exhibit a sense of entitlement, believing they're special and that they deserve unique treatment. The key signs include a constant need for validation, difficulty empathizing with others, manipulative behavior, and a tendency to exploit others. Dr. Ramani Durvasula emphasizes that narcissists are often charming at first, making their true nature harder to detect initially. In relationships, narcissists tend to idealize their partner at first, showering them with love and affection. This phase makes it hard for victims to identify the toxicity that will come later. The narcissist creates a fantasy bond that's not sustainable. After the initial idealization, the narcissist will often devalue the partner. This can include emotional abuse, neglect, or even verbal attacks. The person is then discarded when they no longer serve the narcissist's needs or when they challenge the narcissist's ego. Narcissists are experts at gaslighting, and this involves making the victim question their reality. They might deny events, they might twist the truth, or accuse the victim of being overly sensitive, often leaving the victim confused and unsure of themselves. Narcissists need constant narcissistic supply, validation, admiration, and attention from others. They feed off this admiration, which is why they often seek out new sources of supply if their current ones become less willing to cater to them. Narcissists believe they are special and that they are entitled to privileges or benefits that others are not. They often see themselves as superior to others, leading to poor treatment of those they view as lesser. One of the defining traits of narcissism is a lack of empathy. Narcissists cannot or will not understand the feelings of others, and as a result, they often act in ways that hurt those around them without remorse. In relationships, narcissists are often controlling and manipulative. They are emotionally unavailable, and they demand that their partner put their needs first. Victims of narcissistic abuse often feel isolated, powerless, and overwhelmed. Narcissistic abuse is often subtle and insidious. Dr. Ramani Durvasula points out that the victim may not even realize that they're being abused because the narcissist uses tactics like gaslighting, manipulation, and guilt tripping to maintain control. Narcissists often create a trauma bond with their victims, and this is a psychological phenomenon where the victim becomes emotionally attached to their abuser despite the mistreatment. This bond is strengthened through intermittent reinforcement, occasional kindness, or affection mixed with abuse. Narcissists can also be found in families, and these dynamics can be just as damaging. Dr. Ramani discusses how a narcissistic parent or sibling can undermine your sense of self, often leading to issues with self-esteem, boundary setting, and emotional regulation. In professional environments, narcissists often take credit for others' work. They manipulate colleagues, and they engage in office politics to maintain their position. Dr. Ramani Durvasula stresses the importance of setting firm boundaries and seeking support from others in the workplace when dealing with a narcissist. Dr. Ramani offers advice for those affected by narcissistic abuse. The key strategies include setting boundaries, maintaining a strong sense of self, and seeking therapy. Understanding that narcissistic abuse can cause significant emotional harm is important for the healing process. And therapy is often crucial for those recovering from narcissistic abuse. Dr. Ramani advocates for therapy that helps the victim rebuild their self-esteem, learn to set healthy boundaries, and process the emotional trauma that comes from being in a relationship with a narcissist. One of Dr. Ramani's primary recommendations for dealing with a narcissist is to implement the no contact rule. This means completely cutting off communication with the narcissist, which can help the victim heal and stop the cycle of abuse. Dr. Ramani Durvasula emphasizes that self-care is essential for anyone who has been involved with a narcissist. Taking time to reconnect with yourself, to engage in activities that bring you joy, and establish a support system are critical steps in recovering. Narcissists also need to control situations and people to maintain their sense of superiority. Dr. Ramani explains that recognizing the narcissist's need for control can help you avoid falling into their traps and manipulations. One of the most empowering things a person can do when dealing with a narcissist is to educate themselves. Dr. Ramani advocates for learning about narcissism and its behaviors, as knowledge allows people to set stronger boundaries, understand their own feelings, and protect themselves. In her work, Dr. Ramani offers hope and guidance for those struggling with the effects of narcissistic abuse. Her approach is rooted in compassion for the victim and the belief that healing is possible even after experiencing the damage caused by narcissistic individuals. Thank you for watching this video. I hope you've learned a thing or two. Please subscribe to my YouTube channel if you've not done so. Thank you.